About the Yale School of Public Health. We have 12 joint degree programs with other schools and departments at Yale. We have 22 centers and institutes. We have a large number of alumni from the school that are in 50 states of the US and in 71 countries around the world. We are a medium-sized public health school, and we have about 140 faculty, so the student to faculty ratio is very favorable. It's 3.4 to 1. And the School of Public Health is one of the oldest schools in the country and was founded in 1915. At the bottom, you can see that currently we have 50 MS students, 86 PhD students, and 403 Master of Public Health students. And I mention this because if you would decide to come here, then you would take classes where you meet all these different students and you would take classes together. I'm very pleased and proud to say that our PhD program is ranked among the very best in the country. And a couple of years ago, the National Research Council weighed a variety of academic criteria and determined that Yale's program ranked third nationwide. We have 100% completion rate and one of the highest yields among US schools of public health, with about 71% of admitted students matriculating. And we are very encouraging students very much to engage in interdisciplinary research and to conduct dissertation research abroad. And a lot of students take advantage of this. Next. So the application to the Master of Science and the PhD program at the School of Public Health goes to the Graduate School of Arts and Sciences. So that's where you would apply if you want to apply for an MS or PhD. The program is called Public Health, and we have 6 tracks, which are the 6 departments in the School of Public Health that offer a PhD. The epidemiology of microbial diseases, chronic disease epidemiology, biostatistics, social and behavioral sciences, environmental health sciences, and health policy and management. So what do we look for in YSPH PhD applicants? And the application consists of several parts, obviously, including the academic record, research experience, letters, but most importantly is the personal statement that you provide. Because this is sort of the only way you can tell us why you want to come to the School of Public Health and what you want to do and why you've chosen to apply to our program. There's no other place in the application where you can express these sentiments. And what we're looking for in an application is a fit with the PhD program in public health. So you will have to tell us why you want to come, and more importantly, with what faculty would you be interested in working with. If we don't get a sense about that, we don't see a fit. So we can't really decide whether we should look at your application and admit you. So this is the most important part. So you should outline what you have done so far, what your future goals are, very broadly, and then list, I would say, about 3 to 5 faculty that you would be interested in working with. And this obviously requires some research that you have to do, that you have to look at our website, have to look at faculty pages and see what faculty piques your interest and you will be interested. And that should be highlighted in your personal statement. The next important part of the application are the letters of recommendation, and choose wisely. Choose somebody, a faculty or somebody you worked with at a company that can tell us something more about you. Something that we don't see in the application, like you worked with a person, did a research project together, and that person can tell us he or she did a wonderful job, was very engaged, was very proactive, and was a delight to work with. So if you have a teacher that you took a class with and you maybe interacted twice with that teacher, that's not a good person to write your recommendation, because all that teacher will tell us, he or she took my class and she was a fantastic student. And we know that already from your transcript. So really choose faculty or people you worked with at the health department or a company or an industry that can tell us something about you. Academic record, yes, we look at it, but it sort of comes secondary. And what we really want to find is that there is a fit with you and our program, and we can mentor and teach you and get you going for the next step in your career. A few other important points. So we provide guaranteed full stipend and tuition for 5 years. I think that's very important, and some schools don't do that. I won't mention them. But that's important, and that's something when you apply also to other schools, make sure you get that information and find out what is the funding situation. Next, I've listed some of the milestones. So first year would be coursework, second year would be coursework, teaching, you'll be a teaching fellow, and then the qualifying examination. And the third year milestone would be the submission of your dissertation prospectus, which is an outline and description what you're going to do for your dissertation. And the final milestones are dissertation research and then defending your dissertation. And our average time to graduation is 4.8 years. This last slide just outlines career outcomes from our graduates. As I mentioned earlier, we have 100% graduation rate. And also the students that graduate, I would probably say 99% of them have a job almost immediately and still are employed to date. And as you can see, the majority of our graduates go into academia, either as research or as faculty. Secondly, in business, industry, or financial firms. Government public sector is also where they go, like CDC or public health departments. And there are some other ones that are listed here, but clearly the major next step of our graduates is to go into academia. So I hope that this overview gave you a little bit of a sense about what our program is about. And we all are very keen and interested hearing your questions and get anything more cleared out and anything more that we can help you to make an informed decision about applying to graduate school.
Okay, I think I'm going to stop the share, and then so you guys can see our lovely faces.
Yes, you'll have to change the camera too. I don't think we're visible. There you go.
There we go.
There's Tyler.
So I guess now is just the time for Q&A.
Before we get into the Q&A, if the two students could really talk about their experience, why they chose Yale, and possibly the experience so far.
Why we chose Yale and the experience so far. Do you want to?
Yes.
I can start with that. Hi everyone, it's Shannon again. So why did I choose Yale? I think there are two main reasons why. I think one was faculty. So in my search for, or I guess in my solidification of my research interest, one of the main goals that I did when searching for schools is looking for faculty that match those interests. And at Yale, I kind of found more than one faculty member that tied into my overall goals. So that was an easy pick. And then also, as Chris mentioned, the stipend is pretty nice. It's a decent livable wage compared to a lot of other schools and programs. So yeah, that kind of was my decision.
Yeah, I'd echo a lot of what Shannon said. I think that primarily it was related to the research interests, and I think that I knew a couple of the faculty before I had even applied, but coming here for the Prospective Students Day was really helpful in getting to know better some of the work that faculty were doing and how it would align with things that I was interested in. So that was really useful for making my decision. And then I think that there was a lot of instrumental reasons why I chose Yale. I think partly the stipend and just the fact that New Haven's a really livable city on a limited income was a big issue for me to consider. Also, I really wanted to uproot myself from where I was really established. I'm from New York originally, and I was looking at schools in New York, but I think that if I had stayed in New York, it would have been harder to focus on my academic studies because there would have been so many distractions. And I think that it was really helpful to come to a place where I didn't have that network and I could really just focus on my research, focus on the program itself, and not be distracted by too many other things.
And I think the second part of that was experiences so far.
Yeah.
I think in general, PhD programs are very difficult, and I think we can only speak to our Department of Social Behavioral Sciences, which is relatively small. We have a lot of support. I mean, it's only, I think the class is what, 7 people now? 8 people now. So I mean, anytime that I have a question or I need some kind of support, I can go to my department head or my advisor. And then we also have Chris and Melanie, who are kind of like our school mom and dad, who definitely help us out a lot with everything that we need, whether it be academics or just personal life stories. But yeah, I think Yale does a really good job, especially the School of Public Health, at supporting their students moving forward. I don't know if anything they have issues with.
Yeah, I'd agree with that. I feel like the process is generally one of self-doubt. You're amongst a bunch of people who are all at different phases of their research trajectory, and sometimes that can be really humbling when you see people who feel like they're further along than you are. And so it was a lot of questioning whether or not I'd made the right decision to pursue a PhD program, especially as someone who had taken quite a bit of time off between the last time I was in school and then returning to school for a PhD. I think that I was really second guessing that decision. But I agree that the faculty were really supportive. And I think one of the things that the department chair of SBS, Trace Kershaw, always likes to say is everyone has an individual process and an individual progress. And I think that it's hard to hear that and take it seriously. But I think that the reiteration of that constantly did help me realize that you can't compare yourself with other people because your research is different than their research. And it's going to take a different time period to do all of the prep and do all of the analysis. And so don't feel disheartened. And so I really feel like the faculty were helpful in those first couple of years of getting acclimated and figuring out what I was doing to make sure that I didn't sort of drop out and think, no, this isn't for me.
Okay, great. So student attendees, if you could answer, if you can ask the questions in the Q&A section of the platform, we'll ask them. So the first question I have is, a student wants to know if they apply for the PhD coming out of the bachelor's degree and they're not admitted to the PhD program, would they be considered for the Master of Science program?
That's one of you question.
So if they didn't get accepted to the PhD. So is it a question?
They would have to write to us. Yeah, they would have to write to us and ask us if they could be considered. The only departments that's able to be done in are biostatistics, chronic disease epi, and epi of microbial disease. There's no guarantee that the faculty would admit them for the Master of Science, but it would be something they would look at. So we just need an email that says, I would like to be considered.
Okay. Can you also talk about what percentage or the likelihood of students coming directly from undergraduate college into the PhD?
Percentage of students who applied straight from undergrad get accepted.
Probably a quarter to a third. So the number is low. Most applicants have some time in between, have some work experience, or did another degree, did an MPH or a Master of Science.
Okay, the next question is, how does Yale provide support for first generation and or low income students or students of color in the PhD program?
That's a really good question. I think that support that you have to seek out. I think that's kind of at any school, you would have to seek that support out. I've found that support at the grad school level, at GSA. I'm also like a diversity fellow, so like Denzel like is obviously like a major resource to reach out to. But I do think there are groups throughout the grad student assembly or union where you can find that support. In terms of
Small programs.
oh yeah, so like if this YSPH generally is like pretty small, so I feel like if you wanted specific support, you can obviously ask for it, especially for low income students looking to like go to conferences and like print posters, which is and I guess just get material that you need for your studies. It's just a matter of like you having to kind of find those resources within your department and also within the larger grad school community.
Maybe I can just add that just a few months ago, the School of Public Health appointed an associate dean for diversity and inclusion, Mayo Desai, recognizing that we need to do more. So I would say that there's going to be more support at the School of Public Health for this than we had in the past.
One student has a question about talking about faculty members you're interested in working with. Are you able to talk about faculty members who have an appointment in another department than the one they're applying to?
Absolutely, absolutely. I probably didn't mention this enough, but we really encourage interdisciplinary research, and particularly I encourage students, to seek out in other departments, seek out other faculties, also to have them on their dissertation advisory committees, and not just within the School of Public Health, but all across the university. And several of our students work with faculty in the law school, in the School of Management, and in the School of Forestry. So absolutely, this is very much encouraged.
Can I say something? YSPH does a really, really good job at emphasizing like people or students kind of going outside of this department and figuring or like connecting with other faculty and students in other departments. A lot of our classes are cross-listed. Also, we're able to meet faculty of different departments and schools. So it makes for a really interesting and I guess cool time to do coursework, if that makes sense. Yeah.
Yeah, and I can just provide a specific example. When I was accepted, I had two mentors, one of whom was in a different department. And as I'm pulling together my committee for my dissertation, one of the people on it is at the School of Medicine. I've been speaking with folks at the School of Management. So I do think that there is a huge emphasis on being interdisciplinary. I think public health is an interdisciplinary field, and Yale really tries to model that and how they approach both course selection as well as just mentorship and guidance.
Okay, the next question is, I'm a non-traditional student. I completed an RN BSN Bridge program, and I'm currently completing the final year of an MBA program. Does that put me at a disadvantage in applying to the PhD program?
Hard to say. I don't want to say no, but it's hard to say.
I think there's some kind of power in not having a traditional background in public health and making an argument for why you think you need a public health degree. I think it's just a matter of you framing your personal statement in a way that kind of shows that your background is an advantage and not a disadvantage. So yeah, of course you can't say yes or no, but there's some power in having something different and offering a different perspective to public health research. Just making sure your personal statement, as Chris said, is like on point, and that you can frame all of those things as an advantage as opposed to like a major difference.
The next question is, I've seen online that the School of Public Health offers a concentration in public health modeling for MPH students, which really makes the school stand out to me. To what degree are PhD students able to access these courses?
To the same extent like any other student at the School of Public Health or at Yale University. these courses are not restricted to somebody who's doing the modeling concentration. None of the classes are restricted. We don't actually allow caps on classes in the School of Public Health. So PhD students won't get a certificate in modeling, but they can work with faculty in the modeling concentration, and they can take all the classes, seminars, and there's absolutely no restriction.
Great. The next question I can probably take. The question is, does Yale cover health insurance? And the answer is yes. As part of your PhD funding, all students get full health coverage. And in the cases where you have a family, you're moving to New Haven with a family, there's also a subsidy towards your family's health coverage. So yes, health insurance is covered by the graduate school for all graduate students. The next question asks, can you briefly explain the qualifying exam and what it entails, as well as how students are prepared to successfully pass the exam?
Oh, yeah.
Well, it differs.
Yeah, that's a tough question because each of the different departments has a different process for the qualifying exam. So like I can speak, I just qualified over the summer, and our qualifying exam process is that you do a systematic review on a topic related to what you're interested in pursuing for your dissertation, and then you submit that to the department. They have a committee of 3 folks who review that product, and then you have kind of a mini oral defense where you meet with those 3 folks and they ask you questions about your methods, about your findings, and you respond verbally. But that's unique to social behavioral sciences. The other 4 departments are slightly different. Maybe you can kind of describe what that process looks like.
Yes, they're all different. So one extreme is epidemiology of microbial diseases, where your qualifying exam is actually reading with 3 faculty and writing your prospectus. And then you defend your prospectus, which is your dissertation work, in front of that committee. In EHS, environmental health sciences, they do it similarly. On the other end is chronic disease epi and biostats, where you actually do another exam on biostatistics and epidemiology. So it varies in each department, and that's something that is easily accessible on the web. So I became DGS 11 years ago, and as far as I can remember, no student has failed or was kicked out because she or he didn't pass the qualifying exam. It has happened in rare occasions that a student had to retake a part of the qualifying exam, but then succeeded in the second trial. And we make sure that students are well prepared to go into the qualifying exam and make sure that they don't fail.
And that's generally built into the curriculum too, where in, for example, the second semester of your second year, you would actually have a course designated towards applied area readings in preparation for your qualifying exam. So the idea would be that you would be having protected time to meet with your advisor, to meet with your dissertation committee, to make sure that you are getting all of the background that you need to make sure that you're successful in your qualifying exam.
Okay. The next question, what is the percentage of international applicants every year? Does the selection differ for international applicants?
It used to be like 50% were international applicants, and over the past 3 to 5 years, there has been a drop of international applicants for a reason we don't understand. So at the moment, I would say maybe 10–20% of the applicants are international. The selection process or the review of the application is exactly the same. There is no difference. And we have funds to provide for 5 years for international applicants. Again, if they fit the program, and we think they could be an excellent fit with our program.
And I should add that graduate school-wise, around half of our applications are international. So in the incoming PhD cohort, I think around 45% of the students who in their first year of the PhD are from foreign countries. And we don't distinguish in terms of funding between domestic and international students. Once you get an offer and you're admitted to the PhD program, you receive the same level of funding. So that you should definitely feel welcome to apply, because we have a ton of international students, and you'll definitely find a community here with students from, in most cases, your country, but definitely your region, who are pursuing the PhD at Yale. The next question is directed towards the graduate students. How did you find that your previous academic degrees or work experience impacts how you developed your research interests?
That's a good question. I think for me, you know, having quite a bit of previous work experience, my research is oriented around sort of my work experience. So my work experience was in capacity building around evidence-based interventions for HIV and substance use. And so my research interests are really focused more on sort of the implementation piece and an implementation science framework and intervention development. So I think that my background really segues neatly into what my research interests are, and really informed not only my research interests as a topic, but also as an approach and a methodology.
Yeah, I'll agree with that. I think I have a very interesting background. After I did my master's, I worked in like advertising and production, and then I went back to the Department of Health. So my research interests are more so segued, I guess, to my work experience at the Department of Health, where I did a lot of place-based work. So my research interests now kind of align with place-based interventions in terms of gentrification and marginalized populations. So I guess the work experience definitely shaped that interest, but also I can argue that my master's, I guess, gave me some insight into intervention work, where my advisor, my mentor during my master's program did a lot of place-based interventions in terms of obesity. So I think they both play a major role in shaping my research interests. I think I will say that having a master's does seemingly help in the PhD process, because we're able to kind of waive classes. So it gives us more time to think about our research interests, and I guess to mold those interests in terms of our dissertation perspectives and getting those ideas flowing so we can graduate in a timely fashion. So yeah.
Related to that, did you just speak a little bit about a student entering with a master's degree and how you can get credit for those past classes that are part of the master's?
Okay, yes, it's been deferred to Melanie. The graduate school allows 3 courses from another master's program to be waived. And so students with a master's in public health can easily find 3 courses. Oftentimes they can find more than 3 courses they would like to waive. So we allow substitutions when they get beyond the 3rd course, so that you just have to talk to your advisor and find a course that you want to take that would be considered a substitute course. And it's, you know, really seamless, and we work with you to make sure you're not sitting in classes that you've already taken.
Okay. The next question is, can you speak to your quantitative training in the SBS program?
That's the one word for me. It's a very dangerous word for me.
Yeah.
So by training, I'm a qualitative researcher. So I part of me coming in for the PhD was to learn some quantitative skills. I will say, as a student, Stats and I we don't get along. We're not the best of friends. But I do, again, like have the support of faculty in SBS to learn the skills that I need to learn. So for example, like our department head who's on sabbatical, for example, if I asked him a question of like, how do I approach this question in stats or in SAS, he'll take the time out to show me. And the same goes for my advisor. If I have any questions, she'll either help me or direct me to someone who can help me. So I guess the quantitative skill learning process in SBS is pretty seamless if you just ask questions and ask for help, which is also difficult as a PhD student. I feel like it's hard to ask for help as a student. And that's probably personal egos, speaking from personal experience. But once you ask for help, the help is there.
Yeah, so as PhD students in social behavioral sciences, and I think that this is also true for chronic disease epidemiology, we're required to take 3 biostats courses. And mostly people take that within the biostats department, but there's also offerings in outside of the School of Public Health, and I kind of took advantage of both courses. And I found that it was really useful. I also found that I needed more than those 3 courses. And so even though I'm done with my coursework, I'm still pursuing additional quantitative training specific to sort of social behavioral sciences. So things like social network analysis and geospatial analysis. And I think that one of the things that's really nice is that I really have found that professors are very willing to let you audit courses if you need additional training beyond what's required in the coursework. And so that's been really helpful as I'm planning out my prospectus and my dissertation to think about, okay, what are areas where I need to build up my statistical knowledge, and how do I do that in a way that is sustainable, not just learning concepts, but also building connections with faculty who can provide that guidance and support once you're actually in the weeds and doing the work.
I will also say that YSPH does a really good job at, I guess, tutoring their students. So for example, like statistical software, we're learning SAS, we have R, we have Python, we have all these different ones. But YSPH does offer like SAS and R tutoring for master's students who know what they're doing and can teach other people. Also, the grad school community has like a very, I guess, robust quantitative learning scheme. So like, what is it, CSSI?
Yeah.
CSSI, yeah, the stat lab. So you have all these resources. Again, it's just a matter of you like going out and looking for them and finding time to put them into your schedule.
Yeah.
And going off of that, we have a question about what qualitative research opportunities and workshops are available.
So for SBS, I feel like every faculty member in SBS kind of does some aspect of qualitative work. So it's very easy for you to dive into it if you need some practice. I know there are a lot of classes, for example, in ethnography and anthropology that you can take as, what do you call those things? Electives. I was like, what do you call them? As electives to kind of make your coursework or your course schedule more robust. I don't think they're like obviously not tutoring hours for qualitative analysis, but I'm pretty sure you could find someone on campus, either a YSPH or at the grad school, to teach you quantitative software or qualitative software if you need help. But yeah, I feel like everyone in SBS in particular does some level of qualitative work. So if you have any questions about like in vivo or the deuce, you can ask anyone.
And there is a course on qualitative methods that both Shannon and I took. It's actually required for SBS students, but is again open to all students regardless of the departments that they're in.
And Kate, is Kate Nyan?
Yeah. So Kate Nyan is our public health librarian. So if you have any questions about that, she can definitely direct you.
Yeah, she's a really fantastic resource.
She is. I have to email her.
Great. The next question is, I'll sort of broaden it a bit. If you're interested in doing work in a research lab or another area of the medical school, is that allowed? And how would you go about doing it?
Absolutely, yes. As I mentioned already, that we foster interdisciplinary work, and whether you find somebody in the medical school, school of law, forestry school, school of management, it's all encouraged. Wherever your interests are, and we promote that, absolutely.
Okay, great. The next question is, can a student maintain their full-time job in government or another sector while they pursue a PhD? So I'll broaden that question a bit and ask about, is the PhD, are you required to be a full-time student?
Yes, you are required to be a full-time student. You're allowed to do 10 hours per week of other work, but you have to be a full-time student, absolutely. And I would say, just from talking to students, I mean, it is a full-time job.
Mm-hmm. With overtime.
Yeah.
Okay, I'm scrubbing for some more questions. How detailed should the personal statement for the application be? Should I include my prospective research topic for the dissertation?
If you know that, absolutely, yes. Again, the more we know about you, what your interests are, what you want to study, where you want to go next, that will help us to decide whether you are an excellent fit for our program or not.
There's also something to be said about, I was just talking to someone, was it you? I don't know what it was. We were talking about personal statement research topics, and there's this balance of not being too pointed, but not being too vague, because you don't want to be locked into an idea. I know personally I wrote my personal statement on kind of the same thing, but it's definitely changed over the course of time that I've been here. So you just don't want to be too narrow, and you don't want to be too broad, which is not really helpful but in terms of like measurement scheme. But yeah.
Okay. How do you feel about contacting potential faculty in which you're interested in working with via email?
Oh, absolutely. Encourage that, yes. And most faculty will answer. Don't be disappointed if some faculty don't reply. You're very welcome to send a follow-up email, but after 2 emails, I probably would stop. It's just a human nature that some people are very good at this, some others are not, but I encourage you to contact faculty, and we'll probably say short email. You might want to attach your CV, but don't write lengthy emails. Just a brief introduction, and if you're interested in her or his work, and that's about it. And then wait for a response.
And to add to that, one of the things you can do, I'm going to throw Shannon below the bus here. On the diversity section of the graduate school website, you can look up our fellows. You'll find Shannon. And you can actually, under her bio, you can book an appointment with her. It will ask you whether you're prospective students, and she can call you during her office hours on those days that are scheduled on the website. And she can talk to you individually about her experience or about the admissions process. So feel free to just go to the graduate school's website, on the diversity, click staff and fellows, and you'll find Shannon's information and the link to her calendar. I'm looking to see if we have any more questions. Can you talk a bit again about what Yale looks for in a prospective student as you're reviewing applications?
What do you look for?
What do we look for? I'm probably repeating myself, but we look for a fit. We have to figure out whether the applicant is, I would say, not just a good fit, but an excellent fit for the program. It's unfortunate that we get a lot of applications that we read the personal statement and we can't figure out why that applicant is applying to this school, the Yale School of Public Health. There's no mention of any faculty or any interests. So we need to know that, because we get a lot of applications and we need to decide whether we would be worth interviewing and considering this application further. And the only place we can see this is in the personal statement. Because you can, yes, you can add your CV, but that just lists what you have done so far, but it doesn't tell us what you'd like to do in the future and what research interests you have. And as Shannon was saying, you know, it doesn't have to be overly detailed, and obviously we understand if once you would come here, you might change your interests or modify them, but we need to get a sense of why you think this is a good fit, this program is a good fit.
And what role would you say that GRE scores and undergraduate GPA would play in that process?
In our review of applications, it doesn't play a big role. Obviously, if they are terrible, that will come into play, but otherwise it's personal statement, letters of recommendation, and then obviously we look at the GREs, and quite often we actually don't even consider GREs and GPAs. And there are a lot of studies out that it actually doesn't make any difference whether we look at them or not. We still require them, but a lot of departments' applications are not viewed in that direction. It's really trying to find a fit. Is this a student, a graduate student we want to work with our faculty? And that's the most important point.
Okay. For the graduate students, a question for you. Do you feel courses in the SBS program have a strong commitment to social justice?
Funny enough, there's going to be a social justice track starting soon enough. Yeah, I think they all kind of have this social justice lens. There's a course actually called Social Justice and Health Equity that I think is mandated for all MPH students.
Yeah, it's like the intro SBS
Right.
course for all incoming students.
You can take it as a PhD student, as you can take any other class that you see fit. But I do think, in general, they all kind of have this direction towards the social justice lens. There's a new track coming out for MPH students. And I think a lot of the faculty here are very dedicated to making sure that that stays engaged or becoming more prominent in the work that they do. And the master students also are very, very diligent about making sure that social justice remains on the table in every conversation that happens at YSPH.
Yeah, no, I mean, I agree that I think that that's one of the benefits of having the PhD program and the courses so integrated with what the MPH students do is that they really push the envelope in terms of making sure that social justice is a focus, not just in SBS, but definitely especially in SBS. And so I think that we benefit from that as well, because their numbers really help to amplify that voice and that commitment in a way that the 4 to 8 PhD students couldn't necessarily do in the same way. So it's been a really great focus to have and to see develop even further.
Okay, for the graduate students as well. So there are a lot of faculty members at Yale. How would you recommend prospective students go about finding faculty members who are doing the type of research that they're interested in doing?
That's a really good question.
Yeah, that's a tough one.
I just feel like I don't think there's any tips or tricks to kind of help with that search. I think it's a part of a process. I think you just have to go through the hustle and bustle of scrolling through pages and reading bios and looking at CVs. Again, I guess only to talk about SBS. SBS is a very small department, so it doesn't really take that long. But I mean, if you're dedicated to the work of coming to YSPH or any other school, you'll look through the website vigorously. I think I memorized the homepage of YSPH by the time I applied. And other schools that I was applying to, but I don't think there are any ways to get around figuring out what faculty match with your research goals. You just have to read and read and read.
Yeah, I mean, I think that I kind of knew that I wanted to do social and behavioral sciences, so I just looked at the department website and was looking at faculty under there, but also just from having read research articles before, I knew that there were faculty names that kept coming up in those research articles that I had noticed were at the Yale School of Public Health. And so that's also how I found faculty who were outside of the department was, oh, this person, they keep coming up, but they're at the Yale School of Medicine. I should reach out to them once I'm here, or this person's in a different school entirely. So I think that that's another good way is if there's big names in the field, try to see where their appointments are. And sometimes people have dual appointments, so that's another thing to sort of keep in mind.
Okay, we have time for a couple more questions. One of which is, could you describe the culture of the program in terms of health topics that faculty and students are drawn to?
I think that's a two-part question.
Yeah.
Okay, so let's start with culture.
Yeah.
Again, I think we can only speak to SBS. SBS is relatively small, so we're all very, very close. But also I think the YSPH incoming classes are also very fortunate. I have really good friends in EHS, and EMD. So the culture is very welcoming. I think we all know each other because there are only but so many of us. And then what was the second part of that question? Was it like
Research interests.
Yeah, research interests generally, the health topics that faculty and students seem to be drawn to.
I feel like there's like a vast array of health topics. And I know people who are like SAPOs, like doing Arctic work and like nutrition. You have people who do substance abuse work, people who do place-based work. I think there are a very wide array of topics, also depending on your department.
Yeah, yeah, I think that that's tough.
Yeah.
I would just add in terms of culture, you know, we had mentioned before the interdisciplinary fit. I think that that's a big part of the culture, is not feeling limited to what YSPH has to offer, but seeing it as a springboard to launch into what, you know, the world has to offer. And I think also like the sort of other side of that is a sense of flexibility in the program. I think that one of the things I wish I knew coming in was how flexible the program would be, as long as I could make a case for why I wanted to pursue an alternate path. And so I think that, you know, knowing now what it is that I want to do and what my focus is, I wish that I felt more comfortable asking about sort of alternative arrangements and saying how I could sort of tailor the program to match my research interests. And I found that there is a lot of opportunity for that. And I just wish that I had known that that was an option going into the program.
Okay, thank you. And I'll close off, I guess, with the final question. A lot of the prospective students are probably a bit nervous about applying to Yale. Knowing what you know now, graduate students, can you give them, based on having gone through the process, what one thing you would advise students to focus on as they're thinking about applying to Yale?
One thing.
With your vast experience of applying to PhD programs, what is one tip you can give the prospective student that you think would be a real nugget as they approach this process?
I feel like one of the things that I've been really struck by is that the application process for the PhD is a lot like dating. Like, you want to make sure that there's an appropriate match and chemistry between you and the PhD program that you're applying to. And sometimes like PhD programs are really interested in you and you're not interested in them. And sometimes you're really interested in PhD programs and they're not interested in you. And I think you just have to, you're looking for that mutual match, because if you're really interested in the program, but they're not really interested in you, that's not going to work out even if you get accepted later on down the line. You really want there to be mutual excitement and chemistry. And I think that that was what really drew me to Yale, was coming for the Prospective Students Day. I got a sense that people were excited and interested in what I potentially could be doing. And I got really excited in what faculty were doing. And so for me, it was that nice, perfect match that you're looking for. So I think that that's the way to approach it. Don't feel like you have to bank on the school's reputation. You want to look at, you know, do I actually feel a sense of affinity for this school, for the folks who are at this school? Do I feel like the faculty who are there are people I could work with? Do I feel like the current students are people I'd want to be, you know, working with collaboratively on projects? And if you don't feel that way, thinking about why that is the case.
I think I'll say two.
Jeez.
So the first one is, I think imposter syndrome is real, and you don't only feel it when you're in a program, you feel it also when you're applying to a program. And I think I felt a lot of imposter syndrome as I was applying to PhD programs. And I will say, like, just apply. Just apply. I mean, you might, writing a personal statement or getting your letters of rec or reaching out to faculty, feel really discouraged. I'm pretty sure I blacked out the entire alphabet, like applying to PhD programs. But I think all in all, you should just apply to any program you can, and that's within your means. And the second part, I think I just want to emphasize about the process itself is just, as Chris said, and as Denzel's probably said many times, and as Adam has said, and Melanie as well, the two important things are your letters of recommendation and your personal statement. And I think the personal statement is very, very important. And I think as a qualitative researcher and as someone who's read personal statements before, there's power in narrative, and your personal statement should not be a regurgitation of your CV. It should tell your story, whatever story that is. So making sure that's very special to you will kind of shine through and allow people who are on the committee to read it and connect. So making sure that you have that narrative is very important.
Great. And with that, 1 minute over. thank you all for joining, and we'll try to get a recording of this up on our website by next week. So you can check back undergraduate school's website under diversity and virtual information sessions, and you would find a copy of this recording. So thank you so much for joining us today, and we look forward to reading your application.
Good luck, everyone.
Bye-bye.
I can't. He was over at 47.
He was?
Yeah.
Yes, he was, because Lori Marr was texting me telling me that he was over there. He never asked me where it was, so I had